The FAI module allows you to track and measure a series of metrics related to performance in your students. These metrics combined can showcase competency. We measure the amount of times it takes for you to insert a needle at the appropriate trajectory to locate the cam lesion, as well as if your arthroscope is actually striking bone and the number of times it does so. The next piece of data that we capture is the burring. Are you able to remove a specific amount of the lesion? And, as a consequence, did you remove any healthy bone accidentally as well? I'm going to showcase each of these coming up, but the most important feature of this is our precision score at the top. Now, this precision score combines all of these aspects of competency together in one metric. If a student doesn't skip any steps, it will be generated, and you can use that to track their competency over time as they do repeat and deliberate performance of this module. Have your students insert the needle multiple times to have them try and locate the lesion. This will build a skill set understanding the 3D spatial sense of where they need to insert the needle in order to locate that lesion. If you pull the bone out of the body, you can also visualize how you've done. In this case, not so well. I'm trying to hit the lesion up here with the tactile needle, and my trajectory is off. But visualizing this in 3D, I can get a sense of how I better need to adjust. The other piece of this is that I can also take images using the fluoroscopy. So fluoroscopy can be used to sort of replicate what I actually see in the OR to get a better sense of, can I still do this skill set without being able to pull it out and see it directly? This next skill set requires using two tools at once. I've got arthroscopy with my scope inserted. I can also use fluoroscopy to actually visualize where it is, and because it's in a virtual environment, I can use this as much as I want without being worried about the amount of radiation I'm subjecting the patient to. You can see how I'm visualizing the impingement and get a better sense of where I need to go. The number of times I strike the bone with the scope is tracked within the metrics at the end, so my careful and delicate use is measured and appropriate. Get your students to use the burr and remove the lesion carefully so as to not damage the healthy bone around it. Have them repeat this multiple times, knowing that you're going to track metrics around how capable they are of doing it in order to showcase competency and build towards the skills that they would need to use in an OR setting. Coming back full circle now to the score. These metrics that we've captured help showcase how I have done. I've got a precision score generated based on the fact that I skipped no steps. You can see in some areas I did quite well, but in others there's room for improvement. Highlighting this fact is where I know I need to improve for next time. And it's this experiential learning of seeing my outcome to therefore improve upon it in subsequent attempts that helps me grow as a trainee. Use this to your advantage. Have your students complete the entirety of the module or just specific substeps in order to generate the scores that are relevant to their development. Going over this time and time again will help through deliberate practice to improve a trainee's skill set and build them up towards competency. If you have any further questions, please don't hesitate to reach out to us.